Hello, hello, hello. All right, I'm Dr. Tracy McClellan, and welcome back for another training session for the Nurse Aid Training Program. So, hello and welcome everyone to Basic Nursing Skills. These are the core technical skills that every nursing assistant must master, and this is Chapter 7. For those of you, you should have your textbook. Okay, and you're going to discover that there is a lot of important information in this chapter. So number one, the first session we're going to talk about is the importance of basic nursing skills. As I just scanned through the book, there are some great pictures and diagrams to show you definitions and examples. They talk about ranges for adult vital signs. That's going to be important. They tell you about all of the different ways that you can measure temperature. So let's go ahead and get started into basic nursing skills with chapter 7 in your Hartman Publishing book. Basic nursing skills are about accuracy, consistency, and care. They're the foundation of good decision making because what you observe, record, and report helps nurses and doctors provide the right type of care and treatment for your resident. A confident CNA understands that details matter. The way you take a blood pressure reading, measure intake, or handle an emergency can change the outcome. So you become the eyes and ears for the facility. Section 2, measuring and recording vital signs. Vital signs are things such as temperature, pulse, respiration, and blood pressure. Those are our indicators of how the body is functioning. Now, how does that concern you? We need to make sure that you understand the proper way of measuring those vital signs so that we can get accurate results. Temperature. Temperature can be taken orally, rectally, axillary, which is under the arm, tympanic, which is the one that goes in your ear, or oral or temporal on the forehead. Always follow the facility policy for the correct route. Pulse, usually taken at the radial artery on the wrist. It counts beats for 1 full minute. Note its rate, its rhythm, and its strength. That's going to be important. Respirations. Respirations count breaths without letting the resident know that you're counting their respirations. Normal range is about 12 to 20 breaths per minute. That's very important to know. Blood pressure measures with a sphygmomanometer, and we're going to talk about that when you take out your tools to begin measuring blood pressure. The meter that's in the center that has a circle with the numbers in it, that's called the sphygmomanometer, and you will need to know that. And the stethoscope. Remember, the top number, systolic, measures the heart's contraction, and the bottom number, the diastolic, measures relaxation. So when we start practicing the actual skill of blood pressure, we'll talk more in depth about the steps for measuring someone's blood pressure, and it's also mentioned in your book as well. You want to be sure to record accurately, report any abnormal findings immediately, and always clean the equipment between residents. Okay, now measuring weight, height, and intake and output. These are some of the measurement things you will be doing. Now, for your skills exam, you will not be tested on measuring height, but we are going to teach you how to measure height so that you will know how to do that. Accurate measurement is crucial for medication dosages and tracking health changes. So weigh the residents at the same time of day on the same scale with similar clothing. For height, ensure that the resident stands straight or lies flat in the bedridden position if they're bedridden. Intake and output records all fluids taken in and all urine or output produced. Remember, every ounce counts. Measure and record precisely and report significant changes such as sudden weight loss or decrease in urine. All of that's going to be important for you to be sure to report. This section 4 is admission, transfer, and discharge procedures. Okay, are you able to follow along in the book? If not, this video is going to be made available. You can go back and look at it again. CNAs often assist during admission and discharge, moments that can be stressful for residents. They're leaving their regular home and having to find a new home and adjust to that change. And so sometimes that's stressful for the resident. During admission, you want to be sure to greet the resident warmly, introduce yourself, explain the routines, and help them get settled in. During transfers, you want to ensure personal items are packed and residents are safely moved following care plans. During discharge, provide support and reassurance, helping the resident feel confident about their next step. So you want to always remember first impressions and final goodbyes both matter deeply. Section 5, safety, emergency care, and disaster response. Emergencies can happen anytime, from falls to fires to cardiac arrest. So know your facility's policies and always stay calm. If there's fire safety, you want to remember RACE: rescue, alarm, contain, extinguish, and pass for using a fire extinguisher. Pull, aim, squeeze, and sweep for pass. And that's actually on your state exam, so make sure you are familiar with that. Choking. For a conscious adult, perform the Heimlich maneuver by standing behind the person and giving upward abdominal thrust. You're going to learn this in the CPR training session as well. CPR, only perform it if you are trained and certified. Otherwise, call for help immediately and stay with the resident. The last one, falls. Never try to stop a person's fall midway. Guide the resident gently to the floor, call for help, and never move them until checked by a nurse. Staying calm and focused keeps everyone safe, including you. Because sometimes if you try to break a person's fall, you could end up breaking one of your own bones or falling and hurting yourself and also hurting the resident as well. All right, section 6, infection control and equipment care. You'll use many pieces of equipment daily as a nurse aide: thermometers, scales, blood pressure cuffs, and linens. Clean all reusable equipment with approved disinfectant after each use. Always wear gloves when handling contaminated materials and never share personal care items between residents. Proper cleaning prevents infection and protects everyone in your care environment. We also talked earlier about good hand washing skills will be essential if you're going to work in healthcare as well. All right, section 7, recognizing and reporting changes. This is where your role is crucial and vital. You are the eyes and ears of the healthcare team. So your role is very, very important. Remember immediately if a resident shows signs of distress, such as chest pain, difficulty breathing, bluish skin, vomiting, bleeding, or sudden confusion. Even subtle changes like refusing meals and normally they love to eat, unusual drowsiness, or swelling can be early warning signs. You want to be sure and document those changes. Document what you observed objectively and never guess or assume. Use as much factual, timely reporting saves lives. So don't wait until you go to lunch or don't wait to the end of your shift and say, you know, I meant to tell you that she didn't eat any of her food today and her stomach looks real tight. No, that can't wait. You got to go ahead and report that as you notice it. Section 8, and the last section, professionalism and confidence in skills. Mastering these skills takes practice and patience. Never rush or take a reading, fake a reading. You want to make sure that your reading is accurate. Accuracy matters. Ask questions, follow procedures, and trust your training. When residents see you perform confidently, they feel safe, and that trust is priceless. In closing, every vital sign you take, every chart you complete, every calm response in an emergency, it all adds up to excellence in care. We know that's your desire. That's why you chose to come to school, so you could properly learn how to care for people. Remember, you're not just checking numbers, you're safeguarding lives. Keep practicing your techniques, know your procedures, and continue building confidence one skill at a time. In Chapter 8, we'll talk about nutrition and hydration, how to keep residents healthy, strong, and energized through good nutrition and safe feeding practices. And that concludes Chapter 7.